Good morning, good evening, good afternoon. This is Dr. Nelson Garias. I'm your professor for your Monday evening Anatomy and Physiology 2 course. And this week, the topic is frontline immune system or first line defense immune system and skin. And if you've watched the videos, you will notice that the front line or the first line, that's a better way to put it, first line body defense, they're non-specific, and one of the main components is skin, mucus lining, the cilia within your internal epithelial lining. Remember, you have not only skin on your outside, you have skin and layers of skin lining the insides of your GI tract and your respiratory tract. And of course, they have mucus, and mucus traps things. I also put in some notes. And so regarding the skin, the best this video right here, know your layers and know what's in the layers. Um, Let me show you. Let's play this video. Let me get to a certain part that I like. I like that they broke down, and of course here is how you make it bigger.
Hi, it's Mr. Anderson, and in this video I'm going to talk about the integument, one of its functions, and that's important.
To know the parts and
so not only goosebumps, but...
Okay. First of all, and when you're going through all the systems, they're all interrelated, they're all interconnected. But the first thing that you always do is you always go over the functions or the physiology of it all. What do they do? And of course, you have to feel things. You have to have thermal regulation. That means you, when it's hot, you have to sweat. When it's cold, you must shiver. And of course, first line protection, or first line of defense protection. Now, of course, go through this entire video, and you will also see that I also wrote notes for you. Here's the thing: try to do the notes on your own, because eventually you won't have a professor who will give you notes, and I give you notes so that you can compare what you find important versus what I find important. Ultimately, you have to be able to preempt your professor to know, to kind of feel out like what's important. And part of what's important is looking at the objectives of the course, right? And of course, that was the introductory lecture, and also the objectives of a particular chapter. So even if you use whatever textbook you use, and or if you use online resources, you always have to know the parts. And these are, of course, the hair and the nails. They're part and parcel of the skin, and they also perform these functions. Now, I wanted to get to the part of the video that discussed. Let me see if I can find it.
Evaporates, carries heat away, and so it's important in thermoregulation. If we don't get vitamin D, then we...
And vitamin D synthesis, of course, because of your skin. And actually, I am conducting this lecture outside to get my own vitamin D. Now, remember, everything also in your anatomy and physiology, too much of a good thing is a bad thing. Too little of a good thing is a bad thing. So if you lock yourself away for months inside a basement, of course, you're going to have vitamin D deficiency. And too much UV radiation being outside, again, you'll be at risk for cancers or skin cancers. So you could see also vitamin D also important in muscles and bone, and you could see also how the integumentary system or the skin is related. I'm trying to find the layers. Oh, here you go. So if you look at the layers, let me get to a part of the video that shows. Now, you have epidermis, dermis, and subcutaneous tissue. And you can see how they're in layers. And with the more dead skin cells at the top, and the newer ones at the bottom here at the stratum basale. And they call them dermal papilla, because they look like little fingers, because if you see it, they look like little outpockings of little waves of little fingers. And you could see how it's like layered, and just like scales on a fish or or shingles on a roof, and it's done for that particular reason. So know your layers: epidermis, dermis, and subcutaneous tissue. Now, subcutaneous tissue, you could see in real life, fat isn't this yellow. It's more of like a milky whitish yellow. But the fat is important because it is a nice layer for cushioning. And also, you could also see the lower layers, there's more nerves. That's why you could put a pin or needle through the top layers and you won't feel much. But if you go deep enough to these nerve endings here, these deep nerve endings here, you're going to feel something. That's why also you see these nerves also attached to this hair follicle. That's why if I pull your hair, it hurts because it's attached here as well. Okay, and look at for the glands, because the glands are also important, because there's two types. You have your apical sweat and your sudoriferous glands. You need oil to keep this all what? Supple and soft. That's why, babies have very, very soft skin, but by the time you get to be much, much older, your skin gets drier. Then you have some higher risk for cracking, infection, and of course dehydration. And if you look at the, let's see if we can look at another part of this layer, because same thing too, that you could stick a needle in the very, very top parts and you won't get blood. But if you stick your needle further down, right? Let's see if we can get a nice cross section. You'll see here keratinocytes, keratin. Those are cells that make your skin and your hair strong. You have melanosomes and melano. If you recall your your medical terminology, it means dark, right? Melano means dark. Some, body. So these dark bodies here, this person has darker skin, and their genetics are more from a place that's closer to the equator, and their hair will be different. It'll be more coarse. It'll be more kinky, and it's done as a protection for against the UV radiation. Because if your genetics and if your family history is close to the equator, these people are exposed to way more UV radiation, so they'll require way more melanocytes. But if you have somebody who grew up in like maybe Scandinavia with blonde hair, blue eyes, they're not going to have a lot of melanocytes because they don't up that far north. You don't need UV protection as much as somebody who lived, say, closer to the equator. Okay, so that's a nice little tidbit there. That's also in the notes. I wanted to get to blood vessels, but again, this is a very nice video. It's very straightforward. And know the layers and what else is. I think this whole thing is about layers. Oh, here he goes. Arteries and veins. As you recall, the arteries and veins, of course, take nutrients in and out, and also they also perform a nice little function regarding thermoregulation. Acts kind of like a radiator. So if you're cold, right, increased circulation will bring warm blood to your periphery and to your skin, and if you're hot, it can also, along with your sweat glands, also carry water to your apical sweat glands, so that it'll may dissipate some of your heat through sweat. And of course, red is artery, blue is vein typically, and red are oxygenated, meaning to say that the red blood cell is carrying the majority of oxygen, while the blue is carrying, the red blood cell is carrying the majority of carbon dioxide. Now, again, another disclaimer. Please, your arteries and veins are not blue, they're not red, as they may be appearing on your skin. These are conventions that anatomists and medical professionals use to demarcate what wire is what wire. Like yellow, like nerves aren't this bright yellow, but we know that fat and nerves are this color yellow, therefore, because that's a nerve, and this is an artery, and that's a vein. Okay. These are Meissner corpuscles. They're deeper, and they're deep nerve endings. and you have other ones that are a little bit up top, but they're not pictured here. You also have, let's see what else. You see this here? This is a gland, and it's associated with your hair. This is Sudoriferous gland, and uh, every time you stroke your hair, uh, it's going to bend it back and forth, and it's going to release just a little bit oil, so your hair will be a little will be more supple. And but when you get older, this kind of gets dry, and then that's why it also promotes a little bit of hair loss and cracking and that kind of thing. What else about this video I wanted to show? It's nice to know. Okay, let me get out of that part. But you could now see how you take apart these videos, and because eventually this week you don't have any um, concept maps due. But again, I'm always stating that you should make your own notes and do your own things. But for week one, it's always this the lab safety contract. Let's look at. Why does it always do that? Let's look at maybe some lessons and things from. Oh, the introduction to course, the important documents. I think that's where they located the. They put the lab guide and safety contract right here, so you can click on that if some of you were wondering where it was, and that's for task one, right here. Ooh. And of course, the discussion, I already went over that within the introduction. Let's look at some of the salient features of lesson one. Now, look up the inflammation process and the clotting process, because that is also part and parcel of your first line of defense. Mucous, membranes, cilia, and of course tears. Your tears aren't just water; they have lysozymes in it. And if you remember your anatomy and physiology one, lysozymes, lice, they break down things because your eyes are exposed to the outside world, and your tears have to constantly wash all that material out. You have your sebaceous and sweat glands here. Now, this bacterial identification lab, you don't need to do that, but sometimes I look at those things because there's some notes, but um, we're not going to do that part when we're in the laboratory. Okay? And again, for submission for your lesson, of course, due next week, as per the introductory video. Click on this and then look up the case and then answer the questions. All right. Other than that, that is the overview of week one. Those are the things you need to know, and every week you keep on you doing these things, and you're amassing all of these things with the culmination of your online final examination in week 10. All right, everybody. You'll also notice that I posted up here my Zoom number, and I'll be checking in a couple of minutes before 6 p.m. next Monday. So so just try to check in a couple of minutes before, but don't worry if you're gonna miss it. It'll be just shoot me an email or send me a message here. Hey, I can't make it. I will make the video available as well, and also I'll be doing little things like this, just to supplement our lectures. Okay, that's it for week one. Enjoy this beautiful weather today, and we'll talk to you soon. All right.